So joining me now is the Nova Scotia Premier, Tim Houston. Premier, first of all, Happy New Year to you and your family. Let's just start with the news off the top. Not only the delay in in-school learning till January 17th, but I understand that you've had a request now to the military of your province to help in the booster rollout. Can you give us the details?
Yeah, we have. Look, we want to get Happy New Year to you and your viewers as well, for sure. But yeah, we pushed school back today. We can talk about that. But we have an incredible sense of urgency to get these boosters in the arms of Nova Scotians, and I do want to tip a hat to our public health and our Department of Health. I mean, people are just working tirelessly to get appointments set up and to make sure we get these clinics stood up. So we did reach out to the Canadian Armed Forces. We've had some back and forth with them, and we've learned this afternoon that we are going to get a bit of support from them. A couple dozen people will come to help us stand up a clinic. We're very grateful for that, and I will say that through this process, trying to get test kits, trying to get boosters, trying to get support from the Canadian Armed Forces and others, I'm very thankful for the response of the federal government. They've been very responsive to me as a premier and to our province, and I'm thankful for that. But yeah, we have. It's all systems go on these boosters. We really want to get those boosters in arms as quickly as possible, and it's a big challenge.
Okay.
We feel the urgency for sure.
Okay, that's interesting, because it seems to me, if the data's right, you get a booster, a third dose, you're largely prevented from hospitalization. So that's the main door out of this. So you've asked for the military. They're sending, as you say, a couple dozen. Do you know? I'll press you on some details if I can. When they are going to arrive and what exactly they'll be doing. I know there's 200 in Quebec right now. What will they be doing in Nova Scotia? When will they arrive?
Yeah, my understanding is over the next couple of weeks, and this is kind of a developing situation for me too. But we did get word that they will be coming, and what they will be doing is immunizing people. We had some help before in the past, a different stage in the pandemic. They came and they set up a clinic and ran a clinic for us that put a lot of Nova Scotians through that clinic, and that's we'll be looking for that as well. And aside from that, in terms of the urgency, I put a call out last week to just for asking for Nova Scotians, maybe retired healthcare professionals, people that are qualified, that have time and the desire to help out their communities, to stick their hand up in the air. I want to tell you, the response we've received to that is pretty remarkable. It's over 2,000
Wow.
people have kind of put their hand up in the air and said, "Hey, we'll help out. We'll dedicate some time to help our communities." So between the armed forces, the support there, the people working in healthcare, working in public health, and then the additional people that are kind of stepping up, and we're going to get a lot of we're going to get a lot of boosters done in the month of January. It's not fast enough for me. I'm a push guy, run harder guy, but I will say, I mean, having a front row seat, seeing the professionalism, seeing the dedication of the people who are making this all happen, I'm very proud to be a Nova Scotian and very confident.
But it's not a supply issue. Premier, I just want to make sure. If I could say, 5,000 people could come from the military to help you, the supply of boosters is there. So it ain't a supply issue. The provinces have the boosters, like your province has it. It's just an administrative thing. You need the people, the capacity to get them into arms. That's it, right?
Yeah, that's right. And that's how I kind of walked it through with public health. I said, what are the challenges? Challenge number one, do we have the supply? And we've got confirmation of that. Now, some of it comes mid-month or whatever, but I mean, the supply is confirmed for sure, and we're very confident in that. The second challenge becomes, do we have the people? Do we have the human resources that are qualified to actually do the immunizations? And then the third challenge is, where are we going to do it? What's the venues? But the third is not really, I'm not worried about at all. So now we have the supply. We can identify venues, community centers, rinks, whatever,
right.
Whatever. It's all hands on deck. And now it's just the people. And we're getting more clarity on that, and we're getting a higher degree of confidence that we'll get a lot of boosters into arms during the month of January. And that is, as you say, that is what we see as critical to getting out of this pandemic that we're all so tired of.
Yeah, you're delaying, though, in-person schooling until January 17th. Let's move to that, because, boy, I mean, we're both parents. This is real tough on kids. Why not announce that earlier to give parents more time to prepare and frontline workers? Why now? There's big cost to that.
Yeah. Look, I feel very passionate that school is the best place for our children for a lot of reasons. We know that for some children, sadly, but the reality is they're safest at school. It's wintertime, they're warmest at school, and we know that they get a lot of meals at school. So we know there's a lot of social impacts to having kids away from school. And we know that it traumatizes certain families when you change the school calendar, that they just don't have access to childcare. So we understand the impact that we're having on families with making this decision. But on the flip side, we pushed it a week, and you know, the reason we pushed it a week is we want to make sure, we feel our schools are safe, but we want to make sure that they're even safer and that there's a high degree of public confidence. So we're going to use the week to make sure we have masks, 3-ply masks in the schools waiting for students. So we have rapid tests in the schools waiting for students. We're going to make an investment in some ventilation for some classrooms in some of our schools. So we felt that we as a government had some work to do. We had maybe
but is it too late? Like you're using this
right.
week to install Hepa filters in schools, as you said, secure masks. You know the question, Premier, is going to be, why was this not done earlier? Why the delay? It all seems so darn reactive, not proactive.
Yeah, I accept that. I mean, certainly a lot of this stuff should have been easier questions that I'm asking as Premier as well. But the pandemic, things change fast in the pandemic. If we learned anything, it's that you have to adapt and you have to be nimble and you have to recognize the challenge that's in front of you at that time. So we stood back and we accept the challenge that's in front of us, and we also accept responsibility for some of the stuff could have been done earlier. But we are where we are, and we always have to focus on what's best for Nova Scotians, what's best for our teachers and students, what is in the interest of public safety. And when the rubber hit the road, we said these are things that we feel would help keep Nova Scotians safer. We do think our schools are safe, but we always want to make them safer because we need public confidence. The public has to have confidence that the government is doing everything. Right. There's a little more we could do. So I said, let's do it. And probably should have, could have, would have did it earlier. But now it's time, and it's being done right now.
Today, the federal government announced they're going to have 140 million new rapid tests. They'll be divided per capita between the provinces. How will those be divided in your province? Are you going to prioritize schools?
Yeah, schools for sure. We want to have some testing kits in the schools. Nova Scotia has, Atlantic Canada really has been leaders in testing. So, it's a mindset switch now. We're switching away from just a lot of asymptomatic testing to very focused testing. But we have developed a good distribution network. We use some libraries to get them into communities, family resource centers, schools, there's a lot of focus right now on first responders, volunteer fire departments, healthcare workers. There's no shortage of need for the rapid tests, and the tests do provide an important. They're serving an important service in the fight against the pandemic. So we're thankful that we had big orders in before that will arrive in this province hopefully during January. Now the federal government is supporting the provinces even further. We are grateful for that, as I said earlier. But during the month of January, millions of test kits will arrive in the province of Nova Scotia, and we have a plan and a use for every single one of them.
All right, just last question, and real quick, Premier. Of the people in the hospital, what percentage in Nova Scotia are the unvaccinated in your hospitals and your ICUs? Is it largely the unvaxxed that are taking up space there?
No, I would say like in this province in the last 2 weeks, just order of magnitude, we've had somewhere around 10,000 positive cases, 9 or 10,000. Today we have 45 people in hospital, and I think the split is somewhere around 68% of them have some vaccination, whether it's 1 dose, 2 dose, whatever. So we're certainly, the percentage of people that are in the hospital that are unvaccinated is higher than in our general population numbers, but certainly we know that there are still people that are ending up in the hospital that are on the vaccination path somewhere along there. But what I say to that is, imagine how sick they could potentially be if they had no vaccination. Vaccination remains incredibly important. It does protect people from severe illness. The numbers are showing that. But you can still get sick and end up in the hospital even if you're vaccinated. But the vaccination will decrease the severity of it. That's what all the research shows, and that's what all the experts tell us.
All right. Listen, I really appreciate your time. Thank you, sir.
Thanks for having me. Appreciate it.